This is Soundside. I'm Libby Denkman. Across Washington state, K-12 student vaccination rates have fallen slightly, marking 5 straight years with a drop. They fell from a little over 90% in the 2023-24 school year to a little under 90% the following year. But those statewide figures gloss over some parts that saw pretty big declines, especially in one southwest Washington school district. The data showed that the Naselle-Grays River Valley School District saw student vaccinations for diseases like tetanus, polio, and rubella drop by more than 46%, making it the district with the lowest immunization rate in the state last year. Now, that sounds like a dubious distinction, but what's on paper doesn't tell the whole story. For more, we called up Lori Ashley. She is the clinical manager for the Pacific County Department of Health and Human Services, which provides nursing services for the Naselle School District.
The district is a border district, meaning that it is right along the Columbia River, directly across from Astoria, Oregon, and it's a small community. I believe the student body is somewhere 200 to 250 students, K through 12. It's just a rural community.
Looking at the steep drop in student vaccinations, again, 46% between one school year and the next, one might assume that vaccine skepticism encouraged by a new presidential administration with a more distrustful stance on vaccines might be fueling hesitation. But Lori says you have to know the particularities of Naselle to understand what's going on. For one, she said Naselle-Grays River Valley School District migrated to a new record-keeping program called Cumulative for tracking grades, absences, and immunizations, which may have caused information to get lost in the shuffle. Lori also said that because the district is on the southern border of Washington, many students get pediatric care in Oregon, but those records just aren't making their way back across the border. But attitudes about vaccines, Lori says those are changing too.
The third thing that's contributing is vaccine hesitancy, which we have seen across the entire state and nation for that matter. And so we add the 3 factors together, and I believe that's what fell. So as a county health person and prevention person, I look at how do we change this? How do we make 25-26 better? So tomorrow, for example, the school is offering sports physicals. And so when the students come in to do registration for school, they will have a parent with them, usually, and we will have the sports physical, but we're also going to have release of information for students. So we're hoping to attempt to capture vaccines that have happened in Oregon at that time. And that's one step. We're also talking at registration to parents about if they have a shot record to please bring that record. We have started, and it started at the end of last year after the data was collected. The LPN that works in the district has started doing record checks. So she literally went grade by grade, student by student to look. If I have this record on file, does it match what's in cumulative? And working to get the two to match. So I'm super hopeful that Naselle's going to rise back to the top with the green, but we'll see.
You mentioned the rise in vaccine hesitancy. That's certainly not an issue that's only happening at the Naselle district. I mean, we've seen it all across the state, all across the country. How do you approach that issue as providers in schools when it is such a big national conversation and it has to do with a lot of political issues that are going on in the state and conversations around politics? How do you approach vaccine hesitancy with parents?
I personally like to just ask them, what are their concerns? I want to hear, maybe they have somebody within their family who had an adverse reaction. They're rare, but maybe they did. And when did that happen? Because the vaccines that I received as a child are not the vaccines that are happening now. So there's been some improvements in vaccines. And so I feel like just an open and honest conversation about what the hesitancies are, what the concerns are. Sometimes it's just that people don't want to give 3 shots or 4 shots to their child at one time. And you know what? If we can get them to do one or educate them, definitely I advocate that people have a choice. But I also advocate that they get the education to go with that choice.
What are the concerns, like generally, when you see the vaccine rate drop? Like, I think we're seeing like a lot of numbers getting thrown around. Like, if you drop below a certain percentage of vaccine uptake for certain conditions, like you're going to start to see a rise in, say, like measles cases or whatever. When you're trying to encourage somebody to consider getting a vaccine, what are the public health concerns that are driving you, or what are the concerns that are driving you?
My concerns are if we were to get a disease, be it pertussis, be it varicella, chickenpox. If we were to get that, one of the things that happens for us is, again, we're small, and so we tend to congregate. If there is a Friday night football game, the majority of my students will attend that game and they will interact with others at that game. And so I sometimes believe that we have a bigger spread than we would in a larger community. Because in a larger community, typically your younger children wouldn't go to the game. Um, it's more selective as to what people will do, and they tend to be in bigger groups. But oftentimes in smaller communities, the kids are attending a sporting event, and then the next day they all go to a Girl Scout, Boy Scout 4-H event. On Sunday, they may go to some kind of religious event or a youth group event. And so it feels like sometimes, because we're a smaller community, we have a wider breadth of care. Years ago, we had a pertussis case, and that one pertussis case yielded us 120 actual contacts. It was unreal, the number of contacts that we got off of one pertussis case. And we had to track them. We had to track them.
Wow. So right now, it feels like more than ever before, when you talk about vaccines, you're signaling something about your politics, and politics tends to get people's backs up, especially right now. I mean, I guess, how do you try to diffuse the feelings that come up maybe when you have conversations about vaccine hesitancy or vaccine uptake, especially with the national mood right now?
I really revert back to listening to what the person has to say. If the person tells you what's at the base of your belief, what's at the base of what you're making your decision on, and then I can give you the facts. I can give you the research. I'm not I'm not gonna I can't force you or push you. I also talk to people about, if this disease happens in your child's classroom or in your classroom, here's what the consequences are if your child isn't immunized. And it's not just that they're out for the incubation period, they're out for the incubation period after the last child in that classroom or area gets sick. And so for some kids, that could be 2 months out of school. And so it's, I in no way try to do scare tactics. I don't try to do those things. I simply want to hear what their issue is and then give them the facts as we know them and let them make the decision. And I also feel like you need to give people the opportunity to take in the information, sometimes walk away from it, digest it, and then let them come back at you with more questions. Because I believe that that's the key to it, is giving the people the information so that they can then make their decision.
You know, the measles story has kind of been in the news a lot lately because we've seen measles outbreaks in different parts of the country. There have been cases in Washington state, not any outbreaks, luckily, a lot of them connected to travel, people coming in from out of state. Are there plans in place or any conversations happening if measles becomes a serious issue in Washington state, especially considering just statewide, we've seen that drop in the MMR vaccine uptake specifically that looks like statewide we're slightly below what they say is herd immunity threshold for measles. And that, of course, is a super contagious disease. Are you guys having conversations about that?
We are always having conversations about that. We're always on the lookout for it. Pacific County is very fortunate through the COVID-19 pandemic. We had a healthcare providers group that was formed, and they meet. That group still meets every other Monday. And so we talk about whatever's happening. We talk about the potential for measles. We talk about the different things that we're seeing. And that can be vaccine related. It could be rabies related, whatever's happening in our community. We talk about that so that the providers are aware. And it's also our providers giving us feedback. Hey, we've been seeing this, or we're concerned about that. They can tell me, hey, I had 4 kids come in last week and their parents refused to immunize with MMR. And here's what's happening. And then it's if I'm hearing something in that, we have a communications person who puts out education around what we're hearing. So we're trying to keep our finger on the pulse of what's happening and trying to help, again, educate and create a safe place for people to ask questions.
Lori Ashley, Clinical Manager for the Pacific County Department of Health and Human Services. Thank you for joining me and for having this conversation. I really appreciate your time today. Thank you.
Thank you.
Thanks for listening to Soundside. And hey, this show is only possible because listeners support us. If you are able to give right now, check out the show notes for a link to donate. And don't forget, you can listen live on KUOW 94.9 FM Seattle at noon and 8 p.m., Monday through Thursday, or anytime online at KUOW.org.